You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Joy Kung. She's a regenerative medicine and anti-aging expert. So we're going to talk about stem cell therapy and, some of the misconceptions people may have about it, what it's useful for, etc. So welcome to the podcast, Joy. Thank you.
Thank you so much, Richard. It's so good to be with you.
Yeah, tell me a bit about your background first.
The most interesting part is that I actually came from China when I was 20 years old. So I was a full-fledged Chinese person. And then I decided to come have an adventure and really experience a different culture. So I came to the U.S. Despite my visa being rejected the first time. I wrote about this whole thing in my memoir, Tiger of Beijing. But eventually I got to the United States in San Francisco, and I ended up going to medical school at UCLA and specializing in, after medical school, specializing in psychiatry because of my interest in the brain. And then practicing psychiatry for 7 years after residency and always wanting to use integrative approach to health because of my background of growing up in a culture that look at the body as a whole and looking at various systems as being interconnected and affecting each other. So I always thought that was something that was lacking in Western medicine. So while I was trying to incorporate that kind of philosophy into the understanding of what's going on with my patients and help them to do better, I encountered stem cell therapy. And that was a game changer because all of a sudden, you have something that's incredibly holistic, that's connecting all the dots, it seems like, that's connecting all the organs and systems and generating effects that are profound and wide-ranging and helping conditions that I was not trained in. But I was able to do things, producing the kind of improvements in patients that their specialists have no way of doing. They just they don't have the tools. So that became very exciting and a lot of fun to be able to feel that I'm effective, that I'm making a huge difference. I'm making people's life better, and it's very satisfying. So that was 8 years ago. And ever since then, I pretty much have been in this passion of not only sharing this with patients, but also teaching other doctors and making sure that we get this therapy out there, helping as many people as possible. And that's still that has become my life's mission, which is to get this therapy everywhere to as many people as possible. So that's kind of in a nutshell.
What are some of the conditions that stem cell therapy can be used for?
So first of all, it's interesting we're talking today because the FDA just approved the first mesenchymal stem cell therapy ever to be used to treat acute graft versus host disease. So that is, when we talk about what it can be used for, I can't really say that unless there's an FDA indication. And it's interesting that today we've got one indication. Well, prior to that, stem cell therapy has been approved for treating conditions where you are replenishing the whole blood or immune system. And that will be in the cases where people have their entire bone marrow wiped out, usually in cases of blood cancer or autoimmune disease, and they wipe out your bone marrow and then they transplant somebody else's bone marrow. And that will be the earliest type of stem cell therapy. And that's the only one that has been approved up to today. They're probably approved a few days ago. But the use of bone marrow as a source for stem cells and also umbilical cord blood as a source of stem cells are both used for those hemoreconstitution purposes that I just talked about. But now we're having a new indication that can treat graft versus host disease. These are actually for kids because when kids have cancer, they go through chemotherapy, they wipe out their immune system, and they get bone marrow transplants. So even though these bone marrow transplants are, for the most part, perfectly matched, still 50% of them will have acute graft versus host disease. So that's a violent attack of your you're basically new tissue attacking your body. So the graft is attacking the host, and that can be life-threatening. And the traditional way of treating it is using steroid, but it doesn't work on 50% of the kids that are having this reaction. And what this indication is for is to treat these kids that are not responding to steroid, but have this violent graft versus host disease. So there's 70% of improvement. Traditional medicine, basically, there's nothing to do. But now with the stem cell therapy, it actually can reverse the problem and allow people to recover instead of in the case.
Why would stem cells help? A rejection turnaround.
Okay. This is another interesting question you're asking, because when you are getting stem cells from somebody else, the source is very important. So if you're getting it from a very young source, like the umbilical cord, it's a whole other category. But if you're getting it from an adult, so I don't care if you're a teenager or 20-year-old or 60-year-old, getting it from a full-fledged, basically functioning, we consider an adult tissue, even if you're a kid, is still, embryologically speaking, you're an adult. And those tissue, even if it's stem cells that's in the bone marrow, they have already expressed individual characteristics. So even if they're stem cells, the stem cells have evolved. They have expressed surface proteins that may be different from the host, right? If you're transplanting it to somebody else, it can be very different. And that can cause not only your own immune system trying to attack these new cells, but also these cells also are not recognizing your system. So they're trying to attack the host. But if you're using young cell source, for example, if you use umbilical cord blood, the fascinating part is that if you do not match at all, the cord blood comes from a person, you don't match any of the HLA markers, you just give it, from one person to another. You don't even look at it, right? You give it to another person. There's less chance of rejection compared to using adult bone marrow source. So this tells you how complex the stem cell science, the whole aspect of what happens to the cells as you grow older. So a stem cell is not just a stem cell, from a different person. If it's an older person versus a very, very young umbilical cord source stem cell, they can act very differently. So there's a lot of nuances to this. But so if you give younger cells, frankly, you probably I don't know what the rejection rate is, but it's minimal compared to the bone marrow transplantation. So that
why do stem cells help? Is it because are they putting forth extracellular vesicles that are changing or modulating the action of other cells for immune cells?
Okay, so then let's go to how stem cells work, right? Then we'll know how they help. So there are different kinds of stem cells. We were all once a stem cell. We were all single cell at one point, and then the cell started to divide, differentiate, which means gaining function. So the moment they start to gain function, then they start to lose potentials. So they can't have both. But so as you keep gaining function, developing closer to the end organ cells, they may still be stem cells, but they have a certain direction. They can't go back and become, cells. A muscle-oriented development is not going to turn around and become, a neuron-oriented development. So they start to lose capabilities of becoming anything. So there's a great variation. There's a vast array of the kinds of stem cells that's existing. So we can intercept it anywhere along the pathway of this development to put in the body to see if we can utilize these cells to, one, try to develop into the end organ cells, right? The very end of the muscle in your muscles or the neurons in your brain. And so the end working cells in that organ, until it becomes that organ cell, then it is a stem cell. So, but the type of stem cells we're using, the one I was talking about, mesenchymal stem cell, in MSC for short, those are a very special category of cells because they are everywhere in your body. So their function is not so much to develop into your muscle, your bone, or fat, because even though they're from that particular germ layer, right? There are 3 germ layers. So as the fetus was developing, so even though it's from that germ layer that has potential for it to become fat, muscle, cartilage, and bone, they may end up the way they're all over the body. Actually, they're being assigned a new role. The role is regeneration, is to mobilize your whole body, or go anywhere that is needed to regenerate. It's going to sense signals in the body because where does it live? It actually lives right along the wall of blood vessels. Anywhere you have blood vessels, you've got these young cells. Of course, as we grow older, there are less and less of them, but they're hugging the blood vessels, they're sensing what's going on through the blood, and then they're also sensing what's going on in the neighborhood. So they can give the blood signals to bring on more immune cells to help with, reducing inflammation or helping maybe even antimicrobial properties and helping with regeneration. But then they can also give signals directly to local stem cells, telling them to divide and regenerate. Or they can be attracted to signals in the blood and squeeze themselves into the bloodstream and swim upstream to find where the signals are, and then get themselves squeezed out of the blood vessels and then start to work on the local areas of inflammation or injury. So that's kind of what these cells do. The reason they can be so helpful, they can do so many things, is because
they migrate to where they're needed, and then what do they go under? They undergo a rapid differentiation to become that tissue type?
No, that it was what we thought they would do. And that has been disproven over and over again the last 15, 20 years. So now we know that's not how these cells work. They work by signaling the body to recover, regenerate, and develop into new cells, the local stem cells. Their job is not to become a worker cell themselves. Their job is to tell the body what to do. So your body is awakened to actually develop new tissue, but not itself, because they've tracked what happened to these cells. They've tagged these cells like fluorescence, etc. They find their DNA. So every time they make a progeny, they divide. They're going to see, oh, is this from the cell that we're giving, these stem cells we're giving? And it turns out the vast amount of the new tissue was made, had nothing to do with these cells, right? It's not the progeny, because what they're doing is to give you the signal to divide and differentiate.
Are they epigenetically sensitive? Like if you look at the epigenetics of a stem cell on a certain tissue before and after a repair is made, would you see a change? Like, how do you know that they've been a conductor or an orchestrator?
Again, we're back to how the cells work, right? I'm going to get to that. I want to just answer your previous question just to wrap it up. The cells work, first of all, is extremely anti-inflammatory. So it calms inflammation throughout your body. Of course, inflammation is also the driving force for aging and disease. So it can calm inflammation. It can shift your immune system, because so much of what's happening with the diseases are immune system problem, the overactivation or underactivation. And then they can also, of course, talk to your local stem cells, tell them to regenerate. They can also increase vascular formation, so they help with angiogenesis. They can also break down scar tissue, anti-fibrotic properties. I've had great success with people who have COPD or liver cirrhosis or other kinds of fibrosis, such as Peyronie's, right, the curvature of the penis. So all these things, it can help break down scar tissue. It also has antimicrobial properties directly. It has anti-cancer properties, and then it also can rescue damaged tissue, like, for example, in stroke or crush injuries, etc. So it has this wide array of capabilities. And then how does it work, right? How soon does it work? So that's a question of what happens when you get stem cells. And I always tell people there's 3 stages of healing. I'm going to get to that epigenetic portion. The first stage is very fast, is the anti-inflammatory action. Immediately, different cytokines, all these signals are secreted, and you can have a quick response. I've had people respond as quick as within 15, 20 minutes of getting the cells, and the swelling going down, pain going away. It's really wonderful when that happens. It doesn't happen to everybody.
It's amazing.
Yeah. A surgical technician in tears in the middle of a transfusion with an IV drip. She was able to make a fist that she had not been able to make a fist for 2 months. So I saved her, her job, basically.
All right. So you were saying you had a lady literally within 20 minutes that was able to make a fist when she couldn't before. That's incredibly fast action.
Yeah, and I had another patient who has severe pain throughout the body. And when she got off the table, she said her pain was already 50% gone. And then she went home and she slept. The next morning, she woke up and she told me my pain is 90% gone. So it can happen very fast. I had a dementia patient who couldn't feed herself for months. And then the next morning, she was picking up a knife and fork, started feeding herself. It's almost like her brain just opened up. The communication between the neurons all of a sudden is going through. So whatever she was thinking, hungry, feeds off, and now she's able to pick up the knife and fork and feed herself. So it can happen very fast. So that's the first stage. The second stage is the tissue rebuilding stage. So you can think of any tissue, any organ, or any musculoskeletal injuries, you will have tissue damage. And to rebuild the tissue into healthy cells, that's going to take time. Probably, it's like growing anything, right? It doesn't grow overnight. So that may take days, weeks, or even months. Bones, of course, takes longer to heal, and neurons even longer. So that's the second stage. But simultaneously, there's a third stage that can have long-ranging effect, and that is what I call genetic modification stage. That's happening anytime you have cells and they secrete exosomes. Within the exosomes, there are these microRNAs, so tiny pieces of RNA that are able to cross not only the cell membrane, but also the cell nucleus, interacting with your DNA and making epigenetic changes, modifications, rejuvenating and repairing the DNA. And that can have long-ranging benefits. That can last for years, right? Some people will get one treatment and then for a few years, they're doing great because genetically, things are getting repaired. The cells are healthier. So yes, definitely epigenetics is involved. But some people, depending on what they're doing with their body, their health, they may be eating really bad food and not resting. So their body's inflammation level can rise. And then the disease process may still take place unless we address all those factors, which we do at our clinic. You've got to check your hormones. You're going to check your nutrition, check your toxicity levels, and what's preventing you from living the most, vibrant life. And that could be any of those factors, microbiome imbalance, etc. That's a whole field of anti-aging medicine or functional medicine, which is to look at all these aspects that conventional medicine really does not look at all.
Do they have to be injected at the site of injury, or can they act systemically and migrate to where they're needed?
Yeah, I have been a proponent of intravenous route because I think that has profound effects more than just, we give something intravenously and they're going to find the place where it's needed because they're attracted to the areas of inflammation and injury. That's a part of it. Another part of it is that when you put the cells in the vein, they go back to the heart, they get oxygenated in the lungs, and they get back to the heart and gets pumped throughout the body. And that includes pumping throughout your immune system. That's the spleen and the peripheral lymphoid system. And by interacting with your immune system, they can recruit your immune system to come on board and help your body recover. And that allowed me to see profound changes in people. Of course, autoimmune conditions, but even for local injuries, such as the time when I injured myself. I injected locally. I did okay, but it's not until I gave myself an IV infusion of stem cells, the progress was 2 to 3 times as fast. So to me, you don't want to forego that aspect of healing. Yeah, but there are times that if you want a lot more cells in a particular area, you want to inject it. So I've injected into all kinds of places. I've injected into all kinds of joints, of course, muscles, tendons, but also face, scalp, penis, vagina. Yeah, there are a lot of places that you can inject, but sometimes you may not need to inject because the cells can travel really well into particular areas, such as smaller joints that are very well perfused by blood. So the cells can get there. Or, organs like your lungs and liver, the cells are going to be pumped right there. The first pass, they're going to get to those organs. And if you have pathology in those organs, then the cells will be attracted to stay.
What about culturing them, gathering a whole ton of exosomes and just injecting the exosomes only and not the stem cells? Would that be used for certain indications differently?
Yes, it's very popular. I use exosomes as well. I think they're a really great tool, very easy because they are nanoparticles. They can get to all kinds of places very easily. You can put it on the skin. They can, get into your skin. You can put it in your, on your nasal membrane that can be absorbed and can get into your brain or bloodstream. So I think they're very useful, but people have to remember where they came from. They all came from stem cells. So that's what we're using. We're trying to, most of the products were obtained by growing mesenchymal stem cells to huge numbers. And in that growing process, they spew out all these exosomes. So you have to realize that these exosomes are secreted without any stimulation, right? Without really any particular purpose, because they're in the culture medium. So we don't know what they want to secrete and why they secrete it, but they secrete a general set of exosomes. However, if you put the cells in the body where the cells have the information about what your body is going through, and all of a sudden they have a chance to respond to your particular need, so that whatever they secrete will be more tailor-made, right? So, every condition has a different profile as far as what's going on in the body, what kind of signals are around. So they will respond differently. So in a sense, put
Now, there's probably back and forth cell-to-cell communication that would tune what's needed locally. The stem cell, again, could not only send out exosomes, but receive them back, internalize them, recalculate, and then create more tailored exosomes for the cells that need it.
Yeah, exactly. That's exactly what I was saying. That you're getting information and then you're secreting targeted exosomes. So yeah, there's a communication going on. But when you grow the cells in a culture, you're not getting the feedback, right? You don't know what's needed. So you just, kind of spit out the kind of was a standard or stock exosomes. You just, these are what I do, but without any particular purpose that's more tailored. So you can always use these cells to generate exosomes in the body. Actually, I think there's something like 800,000 of stem cells can generate about 80 billion exosomes within a few weeks. So you can let the cells live in your body, and then they will keep secreting these exosomes. Of course, the cells don't live forever. They, in general, live for about 1 to 3 months. But then during that time, they're going to keep producing exosomes. So it's like the gift that keeps on giving. That will not be replaced by just exosomes alone. And this is why I think stem cells have this fundamental advantage, which is the intelligence itself, because it has a DNA. That's the blueprint for life, blueprint of generating anything, including a whole human being. So within that blueprint is the intelligence to repair. And if you can tap into that, then it can give you whatever you need to repair and regenerate. But the exosomes would be one layer removed. It's not going to have the blueprint with it, really.
What about contraindications? If someone has cancer, and from what I understand, there's cancer stem cells. Could stem cells be co-opted to further grow a cancer instead of get rid of it? When should they not be used and why?
That's probably about the only contraindication for a lot of doctors, that they hear about cancer promoting properties of stem cells because they have a tendency to promote growth. So that includes stem cells. Cancer stem cells is a whole different category. So those are erroneous, there is aberrant diseased cells. Really, they're kind of toxic cells. The stem cells we're giving people, of course, are healthy cells, not cancerous stem cells. So these are healthy cells that are supposed to help the body repair. However, if you give stem cells that are older, are more diseased, or just not as vibrant and as potent, such as from a person that's, older, 50, 60, onward, or they have health issues, their stem cells really are not up to par. Not only you have less number of stem cells, but you have a lot less capabilities, including the capabilities of recognizing cancer. So there's a direct comparison study between umbilical cord-derived mesenchymal stem cells versus fat tissue-derived mesenchymal stem cells. So this just shows you the complexity. Just because something is mesenchymal stem cell doesn't make them the same. So they were putting this mesenchymal stem cells, MSCs, next to glioblastoma multiforme, right? One of the most virulent forms of brain cancer. So they put these two types of cells, of course, in two separate, petri dishes next to the cancer cells. And they also transplanted these cells onto an animal's body and put the tumor on the animal's body. And they were looking at what happens to the tumor when you put them next to the MSCs. So in the case of fat-derived MSCs, both in the petri dish and on the live animal's body, the tumor kept growing and expanding. But if you use umbilical cord-derived MSCs, the tumor actually start to shrink and go away. So that's how drastically different they are. So when someone says, oh, cancer promoting properties, well, what kind of cells are you talking about? Because they're not the same. Because the umbilical cord cells, the overwhelming evidence is that they are anti-cancer. Actually, they are used to treat cancer. So it's possible in a few isolated cases that umbilical cord-derived stem cells in a petri dish might have caused more growth, but then also the cells doesn't have the immune system to talk to, right? You can't recruit what's going on in the body to help it. But overwhelmingly, the evidence for umbilical cord-derived stem cells, MSCs in particular, is that they are anti-cancer. So for me, of course, I'm going to have the patient sign a consent and acknowledging that I do recognize that there has been reports, that they understand there has been reports of cancer promoting properties of MSCs, but those tend to be from adult source MSCs. So using umbilical cord source, I think the safety profile is pretty remarkable, but that's something people need to be aware of. That's something that needs to be disclosed with patients. So that's kind of my thoughts. I give myself umbilical cord stem cells every 3 months for the last 8 years. And I do believe that whatever cancer that may be popping up in my body, because we all have them, your immune system, if it's good, should really kill them off. So I do believe that those cells I received are helping me to fight off whatever that may be emerging.
What do you think about culturing your own cells and having them banked so that they can be induced into pluripotency and then used on yourself? The services that do that.
Yes, I'm aware of those companies. My concern is twofold. One, when you use your own cells, whatever your age is, your cells have declined. And there's no question about it because I have a whole YouTube video that's a lecture I've given at various conferences. It's called Are All MSCs Created Equal? Because I go into all of these studies, directly compare adult source stem cells versus umbilical cord stem cells. And it's pretty clear from studies from all around the world, right? These are not my opinion. I'm just a messenger. And it's everything they compare as far as their growth factor secretion, their anti-inflammatory actions, how long their telomeres are, how wide their differentiation potentials are, how many generations they have left, everything. It shows that umbilical cord stem cells are superior. So if you're using your own, it has aged with you. It has taken all kinds of toxic exposures that you're exposed to because these cells have been with you for your entire life. So then there's a risk in that. On top of it, you are expanding the cells. When you start to expand the cells, even if you're expanding umbilical cord source stem cells, the cells will have started to change. There are genetic changes even with one generation. You can multiply them once. Outside the body, there can be errors that these cells produce, and there could be genetic expression, especially if you're growing them in culture. It's a foreign environment. It is stressful for the cells. When they're stressed, what do? They differentiate. They're not going to stay a naive cell and just sitting there. They want to gain function. So the moment they start to gain function, they're also expressing surface proteins that can cause rejection. But of course, if you're your own person, that doesn't matter, right? You're not going to reject yourself. But the stress cells can start to produce inflammatory molecules because they're grown outside the body, and there could be genetic changes. So these are the two concerns. Yes, you can do that, but I personally would still prefer a younger source.
So even if it's not from your own body, there's no rejection associated. There's no...
Not that I've seen, especially if you don't grow the cells. If you start to grow the cells, that's the thing about these cells. These are not mechanical, things that you can just multiply. This is not a factory. This is life that we're talking about. You can't just keep growing and multiplying and allow life to keep repeating itself and thinking there's no degradation. If there's a great reset, that's a different thing. When you start to have a baby, right, there's a great reset. All the genetic abnormalities wiped off, for the most part, the epigenetic problems. Now you're reverting back to the original blueprint. But when you're growing your own cells, you're not going through that process. You're just continuing to degrade. So there's a degradation process because life doesn't just keep growing with no decline. There's an aging process for everything, including these cells. Coming back to the umbilical cord cells being expanded, if you keep growing them, they will start to express surface markers, then they can cause rejections. And this is what happened to Tony Robbins when he went to, I forgot which Central America location. He got his stem cell treatment and he said, oh yeah, I got cytokine storm. I felt terrible for a few days, but then that's just a part of the treatment. What he was experiencing is one, possibly certain type of rejection against the tissue because he was receiving expanded cells. And almost everything overseas are using expanded cells. You can't do that in the US unless it's under a clinical study. So, he went overseas, and so a lot of people and celebrities. So they bought into the notion that you have to have a lot of cells in order to get certain benefits. And the truth is just simply that that's just not true, because you don't need a lot of cells. You need quality cells. The quality overrides the quantity. If the quantity is of degraded cells, then you're better off with undegraded original cells at lower quantity. But if it's the original cells that have not been degraded, then the more possibly you're getting more and more benefit up to a certain point. So that's what happened with Tony Robbins, and what happened with a lot of people going overseas, including some of my own patients, because I have plenty of patients who have gone overseas to get treatment and who have gotten side effects. And then when they come to me, we're using a fraction of the number of cells that they were getting overseas, but they have less side effects and they have better response. So just because you are growing the cells doesn't make them better. Just higher number doesn't make them better, because the cells, when you don't grow them, they have the ability to adapt to your body. So they may not end up expressing all these markers that's going to cause rejection. So it's kind of an interesting thing how these young cells are able to adapt to the host. And when I want to answer your question about the concern of there's somebody else's DNA, what if that stays in my body? Well, I have news for you. That actually happens all the time throughout human history. So as long as humans are around, apparently we have a tremendous amount of DNA exchange. An easy way to detect DNA exchange is by looking for Y chromosomes in a woman's body. So women's supposed to be XX, right? So their chromosome, if they start to have XY, that's a male cell. It turns out that 60% of women have Y chromosome in their body. So this is published by a study. And they were trying to account for why all these women have Y chromosomes in their body, these females. Is it because they had a male child, or is it because they had a miscarriage that nobody knew about? And then, those Y chromosomes got communicated? Or do they have a male sibling when they were in the mother's womb, and that male sibling didn't survive, and then they had DNA exchange? So they're looking at all these scenarios. In the end, they could not account for 60%. They realized, okay, there's something more going on. The only logical explanation is through sexual intercourse. So when male and female have sex, then you are actually engaging in DNA exchange. And that is just part of human existence. Are all the 60% female all have problems because they've got some Y chromosomes in their body, some male cells? No. We actually have seen in implanting human cells on animals' body, and the cells surviving on the animal's body, like for the rest of the animal's life. And apparently there's an adaptation, and they could happen. But between humans, it's even easier. Let's say in the event that these cells actually start to express surface markers that's different from your own, because young cells are acting very differently. Like when I was saying bone marrow transplantation, that's stem cell transplantation. But if you're using adult bone marrow, you have a high chance of rejection, even if you perfectly match them. But if you use young cells from the umbilical cord blood, which is almost identical, very similar to the bone marrow composition, you use young cells, completely unmatched, you have less chance of rejection. So young versus old make a huge difference. So when I give people young cells, that majority of them actually do their work, do their signaling work, and promote regeneration, and they die. So within 1 to 3 months, there's an attrition rate. Nothing live forever, and they die. So for the small number of them that actually survived, which is a fraction, no one knows exactly how many, but the consensus from scientists is maybe 2 to 5%. So let's say you have 2 to 5% of the infused cells that actually settle down in the body, and they are a fraction in the oceans, like a drop in the ocean of cells that's in your body. It's one, insignificant. Two, if your immune system doesn't like it, they can get rid of it, right? That's the end of it. But a lot of times these cells will actually adapt and not express markers that's going to let themselves be taken out. And then they just live in your body, become part of your tissue. So that's kind of the answer of what happens to these cells when you get somebody else's cells in your body.
Okay. How do you get enough of the best quality cells? Can it only come from umbilical cord blood, and again, how do you get them enough? Like if this catches on and there's big demand, how will these things be obtained?
There are a lot of births every day. And when mother's about to give birth, In the US, we only obtain tissue donation from young mothers under age 30. So they're asked if they want to keep the cord for their own child for the future. Or if they say no, which majority of them actually say no because it's kind of expensive to keep them a few $1,000s a year, then they will choose to just, donate. And then they go through a very strict screening process. So that's a whole long process. I don't think we're going to run out of umbilical cord. We're not nearly at capacity. Yeah, I think there's plenty to go around.
Okay. And where can you help people from? Can they fly to you? Do they have to be citizens? Do they have to be in your state?
Yeah, majority of our patients who come to our clinic take a plane to come see us because stem cell therapy is kind of, it's not, you don't have to do it all the time, right? You do it from a initial stage. If you have a very chronic condition, you may want to do the treatment first 3 sessions within 6 months. But then it's a matter of maintenance, whether or not, some people may do fine. If they do everything they need to optimize their health, maybe they don't need another treatment at all. Or if they want to delay and reverse the aging process, then they can come in every 3, 6, or 12 months and get an infusion. So yeah, people fly from all around the world and the country to come see us. My clinic is in Los Angeles.
Okay. What conditions are treatable? Are there certain ones allowed not or what?
Yeah. So the patients who come to us, a lot of them really, they were at the end of their ropes. So they've tried everything. They could be having autoimmune conditions or strange conditions no one can diagnose. They could be having various brain degenerative conditions or traumatic brain injury, autism. They could be having end-stage organ problems like COPD, cardiac problems, a heart attack or congestive heart failure or any kind of vascular issues, neuropathy. They can have liver problems, kidney issues. So really anywhere, musculoskeletal, that's kind of the bread and butter of stem cell therapy. That's just the most commonplace, different joints and back. And sometimes, people come, they want to maybe enhance their sexual function. They can do that. Or facial rejuvenation, or even just healing, for wounds or hair restoration. So it can be for a multitude of things. But I would say 85 to 90% of them are quite significant condition, not doing very well. And this is almost their last resort. So the other 15% will be people who are doing pretty good and they really want to slow down the aging process. They just want to stay in a youthful state for as long as possible and maybe extend lifespan. A lot of people don't care about lifespan. They just care about quality of life. So yeah, so those are the patients we see.
Does it require one treatment or multiple? Like, how do you know how many? I mean, if they're flying in, and how long do they have to stay?
If you come, the treatment itself is only like 2 to 3 hours long. We do a whole bunch of things. We do ozone therapy first, then we do the stem cells, and then we do other IV nutrition. We use laser light as an adjunct treatment. So we do a lot of different things at the same time, but 2 to 3 hours, that's one treatment. And if they have a chronic condition, the expectation is that they may need 3 sessions. But I do have people who after 1 session, they do phenomenally well, and then they may not need to come back. But some people, it may take multiple sessions and it will be doing themselves injustice or disservice if they do not come back to keep pushing on the healing process to maximize the results. So I generally give people the expectation that you need 3 sessions, but it's possible that you don't need all 3. But if you're not getting enough adequate response, then you want to go through with all 3 sessions to really finish the course to make a decision whether or not this is working for you. But if you're coming in just for anti-aging purposes like me, I have been doing IV infusions of stem cells every 3 months for the last 8 years because the anti-aging protocol is every 3 to 6 months. When you're younger, you could space it farther apart. When you're older, maybe you want to do a little closer. So when you're younger, you can do it, maybe once a year even. That's better than nothing. So yeah, so it really depends on the situation.
How can people find out more or contact your clinic? What's the best way?
Best way is to go to my website, drjoykong.com. So it actually has information on a lot of things I'm doing. So not only I have a clinic that specializes in stem cells, but also a stem cell company where we provide my proprietary formulation to doctors because I combine different compartments of the umbilical cord to maximize the cell types and the potency of the product. So that is another arm of what I do, is to make sure that we provide quality and really the best product possible. And then I also have an academy. I founded an academy where I train a lot of physicians. I have a skin cream that has stem cells in it and is 100% natural. It's called Chara Omni, so that's on there. And I have my memoir, Tiger of Beijing. So that would be a really good place to just investigate all these aspects. But my YouTube channel is phenomenal because I hear that from my patients all the time. Most of my patients have watched almost all my videos, and they can get fully educated on every aspect of stem cell therapy. So by the time they come into my door, they already know most of the stuff. So, but that's a really great place to learn more about stem cell therapy. And I also have a podcast, the Dr. Joy Kong podcast, that, I interview a lot of guests and talking about everything that's related to health and wellness.
What if someone has their own doctor? Can you send a kit where their local doctor can administer it, or do they have to be certified by you? Or
always happy to train any doctor who's interested. I've been tireless in my attempt at bringing this to more doctors because I can only treat so many people. I want the doctors to gain the skills and really help as many people as possible. So any doctor who has the open mind to want to learn, I would teach them. I have a mentorship program. You can come in for in-person certification training. Like the next one is in January. So we have a 2-day in-person training. And then there's also an online course that doctors can take. But so the academy is aaict.org. So that's American Academy of Integrated Cell Therapy. So any doctor, but unfortunately, I think things are changing slowly, but majority of the doctors are still very conservative. That's because they were boxed in during their education. I was there because I was at UCLA. I was trained a very traditional way. It's all about disease diagnosis and drug, because drugs are linked to diagnoses. So your job is to find a diagnosis so that you can find a drug. That's the entire focus. And when they get out of medical school in their residency, is the same focus. And then when they get into the new world and they're required to do CME, so they go to conferences where it's all drug company sponsored. So they're caught in the exact same bubble where they actually kind of talk down about any alternative therapy. I was there. I heard everything, right? That's, they think that's quackery. There's no foundation. Never mind, there's thousands and thousands of research articles from some of the most reputable and distinguished universities from around the world that they're finding these incredible things about what these cells can do. So unfortunately, most doctors are not educated on this unless they're more open-minded. They're in the integrative medicine space, functional medicine, anti-aging medicine, or naturopathic medicine. They're more open-minded. Majority of them have trouble accepting is because it's hard for them to jump out of their limited scope unless you are a searcher and you are open-minded.
You have a list of licensed practitioners around the U.S., or is there not that many yet?
We have some. So I've trained some doctors, and the doctors who come to my training. So after they come to the academy training, they do get listed as one of the certified providers.
Okay. Is there like a map on your website for people that can't come to you for whatever reason?
We don't have a map yet. That will be something else on my plate. So I will, at some point we may do that. That sounds like a great idea. But yeah, a lot of times people contact us and we can connect them with a provider that have received training from me. But at some point I probably will do some kind of map to make it easier for people to look for it.
Okay, very good. Anything else I should have asked you, or?
No, you've asked great questions. I think we covered a lot of grounds about the misperceptions that, people think more is better. More is better unless you're using expanded cells, then can be less. And then people think that you have to use your own in order to get great benefits. And that's really not true. And that has been proven, by science, although more studies are needed. So I'm not saying I have a final grasp on truth, because we still need a head-to-head study, right? Somebody is using fat-derived stem cells, and I'm using umbilical cord stem cells. Let's, and standardize the patients, right? Let's randomize the patient population.
You got to put them in a distance and have them fight it out and see who lives.
Yeah, so it's right now it's a little harder to say, although if you look at the science, you can kind of deduce what may be going on with these cells and which one probably is going to work better. And we covered, yeah, I think those are the two most important points. So I just want people, just last thing, stem cell therapy is tremendous when it comes to reducing the pace of aging and even reversing aging. So I've seen that in myself.
You should tell people you came to the U.S. in the 1800s. It works so well on you.
Yeah. So, well, I came here in 1992. So that was that's 32 years ago, and I came when I was 20 years old. So I'm 53 right now, and I definitely look way younger than when I was 43 for sure. So I know these cells are doing something. And it's not just, that would be like an anecdote, right? Okay, so you look younger. So we actually have studies on animals looking at lifespan and health span, and it's consistent. When you give middle-aged animals, so these are rats and mice, we only live for about 20 months, so it's very easy to study how long they live. So when you give them stem cells on a regular basis, starting at middle age, they live always about 30% longer. Not just living longer, but their time of being really well, looking really great is much longer. So you're extending health span. And when they actually dissected the muscles and brain tissue to look at all the markers of aging, including growth factors, neurotransmitter levels, toxic waste buildup, and all these parameters, senescent marker, everything was reverted to the younger levels, which means on a cellular level, these cells are younger cells. So they have proof, not just these animals look better and running better and thinking better. They're actually, all their cells are at a younger state. So I think the time has come that we're able to do this, as a human being, that we don't need to go, to far away places to look for the fountain of youth. We already found it, it's right here with us. So now you don't have to be a king or queen, or even in the past when you're a king or a queen, you still haven't found the fountain of youth. Nobody found it. All the kings and queens were aging and declining, and but now you can be a person just, right now you have to have, modest means to be able to afford a therapy, because it's not cheap. It starts in the thousands and goes all the way up. I know overseas it can be up to $50,000, but at our clinic, generally it's between $5,000 to $20,000. But so it's not cheap, but still, you don't need to be a king or queen to have access to it. So that's what we have right now. So I'm working really hard to see what I can do to bring the cost down. In our clinic, we do give people a significant discount to make it more affordable if somebody has lower income. But I'm hoping to do something that's on a larger scale and really bring the cost down. So yeah, that's coming, and that will be more transformative for the entire population.
Okay, well, very good. Well, Joy, thanks so much for coming on the podcast and spending all this time explaining everything in detail. I appreciate you being here.
Yeah, you're so welcome, Richard. Thank you for your good questions. I think we got a lot of good information out.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.